They say that production of data without use is no point. So that's exactly the point, that NASA data must be used for programmatic policy decision-making purposes. And there are several use cases of countries using NASA for such purposes. For instance, many countries in Asia-Pacific have used NASA for creating arguments on domestic resource mobilization, to actually use the evidence of finance, understand the funding gap for key interventions, and thereby make an argument with the Ministry of Finance to raise domestic resources, for instance. There are other instances where countries have realized that they're not allocating enough for key population interventions, and primarily in some of the regions where the epidemic is really in the key populations. And they've really tried to connect the programmatic data with the financial data and assess where are the gaps in allocation. They've tried to reallocate programs for key population. There are many such examples. The other example of usage of NASA is also towards the global mechanisms. Countries have been able to report to the obligation that they have on global reporting to GAM, which is a global AIDS monitoring, monitored by UNAIDS. But in addition to that, the data from NASA are instrumental in reporting to the funding landscape tables of the Global Fund, which is instrumental in ensuring grant application process through the Global Fund, and then helping in the external financing of AIDS response in the country. So these are some of the examples, but there are numerous such examples that NASA has been instrumental in policy use, advocacy, and use it. The last example that I would also like to cite is how communities use data from NASA. There are several instances where community-based organizations in different spaces, be it on key populations or other kind of community-related aspect, have used evidence to really advocate for increased mobilization of resources for such community-based work.
When the policymakers in a country and the program managers see the financial data and see that it is targeting the areas they wanted to, or it's not, there are shortfalls, I've seen how they've decided and made adjustments, not only to their programmatic implementation, but to policy choices and to financing, so redirected financing. So of course, with the move to get everybody on treatment, countries have had to mobilize funds for treatment. But the prevention sometimes is lagging, and the NASA data has really shown that in the recent years. And in order for them to switch off the tap, they see that they have to put more money into prevention. The NASA is also very nuanced, so it's not just prevention as a big bucket, but which specific prevention interventions need targeting. So if it's condoms or medical male circumcision or PrEP, then we can really give them the evidence they need to make those changes. And I've seen it in many countries doing that. In order for us to avoid a huge treatment cost that's going to continue to escalate as more and more people are infected and are on treatment and thankfully living longer, we need to switch off the tap. We need to stop new infections. We need to put money into those efforts so that the treatment costs can actually start to come down. Actually, that's the aim. Yes, so that's what I mean by turning off the tap.